And so I want to open things up now for questions and answers. And I'll introduce the people who are leading our social determinants of health work internally in the SSHCO. And so first we have Leif Elsmo, who is the Executive Director of Community and External Affairs at UChicago Medicine. We have Angela Waller, who is the Director of Community Health with Advocate Aurora Health. Lisa Cox, a business consultant working with Southside Healthy Community Organization on social determinants of health grant implementation. And a reminder again, to put your questions in the chat directly to Parita Nelaswani. We will get through as many of these questions as we can. And so I think we're ready to jump to questions and answers. Thanks to everyone.
Good morning, everyone. Again, my name is Angela Waller, and I will be your moderator for our Q&A session at this time. And we are going to get started. We have a few questions, and I want to start off with asking Dion a question. Can you give us an example of how your work in food insecurity has really made an impact on a person or family?
Oh, definitely. Well, I mean, I think that's multifaceted. I'll give three different levels of how it has impacted a person or family. First and foremost, high level, when you're talking about food distribution in Chicago, when you're talking about the lay of the land, there's not a lot of Black-led organizations who own food. And so when you're talking about just being a South Side resident and being a son of Inglewood who started an organization, first and foremost, it has affected, me and my team. We've been able to create 16 jobs, paying a living wage of community residents, and we're in logistics and operations. When you're talking about one of the stories that always stand out, it's not necessarily sharing a lot of personal health information, but I just remember when we first started Dream Deliveries, we canvassed in food desert areas all throughout the South and West sides. And one of the residents, she was very skeptical. You know what I mean? When we were going door to door, she has a lot of cats, and so I was already scared. And she said, I'm not interested. But the beautiful thing about it is that as an organization and taking social determinants of health serious, our consistency was the thing that opened up that relationship with this resident, because the next week when our team was coming through making deliveries on the block, she immediately called back and apologized for slamming the door in my face. And she's been a Dream Deliveries recipient since inception. And so that's one thing. Another resident, it would actually be a younger family, a younger mom. She's 24. And she had just lost her job. And she said, can we go on the wait list? After being on the wait list a few weeks, she's been a Dream Deliveries recipient, but this is her second iteration. Actually, when she got another job, she cycled off of Dream Deliveries when she was in a better position. And then recently she just got back on because she's taking care of her mom. And so when we're talking about the ease at which we can deploy this program, is brand new fruits and vegetables that we're getting to these residents, and we're not letting a lot of things get in between them receiving it. If they believe that their food is secure, if they believe that they need it and want it, then we try to make sure that, there's very little barriers to them actually receiving it.
Wonderful. As you can see, we have some amazing partners. So I'll give the next question to Lisa. How will we know when these services will be available?
Good morning, everyone. In terms of the communication, we'll continuously keep you updated through direct mail, website, social media. So there will be, a robust, if you will, communication and outreach that will be going out to you as well as the community at large in terms of how to access these services and the time frame, which we are saying at this point, we know it's close. And I would say, to be quite frank, is more in the late spring area, so not too far off. And we'll continuously keep you posted. Thank you.
Thank you. Our next question is, how did we choose these particular social determinants of health? And are there other services being considered for the future? And I'll hand that over to Leif.
Yeah, it's great to see everybody. Thanks, Angela. Great question. As many of you know, many of the folks on this call have participated in town halls in the past, or listening sessions that we did as we were really getting the Southside Healthy Community Organization off the ground. We did a lot of community feedback input sessions to learn from the community about where we wanted to go with this work. We knew partnering around social drivers was important. So as many of you recall, we had these discussions, and through those sessions, we arrived at 5 that were most frequently talked about, as well as from our own process, data, public health data, these kinds of things. We knew these were pressing needs on the South Side to help improve health. So these are the 5 we started with. We knew they were very important to the community, certainly important to help support patients in the model. And so that's where we're starting. I think there are opportunities into the future. This is a very long process we're looking at here in this transformation space. So what we're asking is if people see other needs or want to continue to share ideas about where we might want to go, we're keeping the general email box open, if you will. So that's info, a reminder, we'll put this in the chat too. That's info@southsidehealthycommunity.org. info@southsidehealthycommunity.org. And you can send ideas, thoughts there at any point, and we'll weave that into the long-term planning.
Okay, thank you. A lot of information, a lot of moving parts, and of course, the organization is still relatively new. So what excites you about SSHCO? And we'll give that to the CEO, Kimberly Hobson.
Well, I tell you, everything about the SSHCO excites me, but I certainly will pull out a few things that rise to the top. And so I do believe that a big part of my excitement is that the SSHCO is an organization that recognizes the needs of the community. The community engagement piece of this organization that Leif just spoke about was critical to us as we developed this whole organization from the very beginning, but it continues to be at the helm of everything that we do. So the community engagement piece of what we do excites me. Also, being a part of an organization that is focused on addressing the needs of the community, meeting the needs of the community right where they are, listening, and then providing resources directly into the community, partnering with community-based organizations, working with patients to assess them, to see what their needs are, and then connecting them to resources out in the community. Those are the grassroots things that excite me. I'm also excited about all of the things that we're doing, but we have the opportunity through this grant that we've received from the state to be able to implement all of these pieces and components of our model that we believe will help to improve outcomes of residents on the South Side of Chicago and improve their health. We actually have the resources to execute on all of those components simultaneously. And so the support that you, the community, give to us, the questions we get in our website, on our website email that Leif just mentioned, all of these things excite me. And the fact that we are going to continue this work over a period of time, make ourselves sustainable so that we can continue to make this impact in the community.
Wonderful. Next question is, how does the tech aspect of your work impact access? And what about people who aren't tech savvy? And I will ask Pierre to answer that question, please.
Yes, ma'am. Our tech impacts the access to healthcare through traditional means. You cannot really access healthcare transport. Generally, in order to access transport, you will have to either look for the transportation company or provider, or you would have to call your insurance agency. And then it would take probably about a week for you to access traditional transportation. What we wanted to do was bring how we normally use transportation as, like, let's say a Uber, Lyft, or a cab, and bring it into the needs of actual healthcare. So for the average person that might not own a vehicle or have a loved one that can actually take care of them, we wanted to be that loved one that takes care of them. with giving them technology and access at their fingertips to have transportation on demand. What that means is if you utilize our technology or our mobile application, you will be able to access transportation within minutes. Generally, through the traditional norms, it would take you about 3 days, at least 48 hours. So whether it's via our mobile application, our website, and even our call center for those that are not tech savvy, they always have the opportunity to access our platform for healthcare. And at the same time, our platform will basically identify the closest transport for your needs within minutes and with a certified driver and clean vehicles that we should have for our healthcare. This will aid in us being healthy mentally as we go to our health appointments. So that is pretty much it when it comes to the technology portion. It's available to everyone.
That's wonderful. And so we will see what we have next. So Kimberly, we talked about the community being involved with SSHCO from the beginning. And so the next question is, will there be any information concerning the Community Advisory Board?
Yes, so thank you so much for that question, whoever put that out there. And so we will not have that detailed information about the Community Advisory Board today, but I am happy to tell you that this is a priority for us. And we are in the process of developing all of the inner workings of putting together and putting applications out to the community for our Community Advisory Board. And so in the near future, you will receive, we'll be pushing this out through our listserv and various other ways, where we are with our Community Advisory Board and asking for applications for those that are interested in sitting on our board. Our overall timeline for this is to begin to have our first meeting of this Community Advisory Board in June or July of this year. And so within the next 45 to 60 days, you will be we'll be pushing out the applications for the Community Advisory Council, and you will be seeing that. And then we'll begin that process. And in June or July, we'll be having that first meeting. So stay tuned, and you will see the applications come out soon.
Thank you. And so what is the plan to expand access of services to the targeted zip codes? The SSHCO has a defined geography, and so we'll let Lisa talk about the services in those targeted zip codes.
Thank you, Angela. There are a couple of questions I see that may be coming through around the targeted zip codes and so forth. I think one of the things we should do is just kind of talk about the SSHCO in terms of the targeted area is comprised from a priority standpoint of targeted 606 zip codes. There are about 15 of those zip codes that we are committed in terms of prioritizing the work and impacting health statuses. So I just wanted to make sure that we recall that, and it's something Kimberly had spoken about as well, and how that work was developed in terms of targeting the geography. In terms of our deployment plan and how do you access the services, because I see there are a lot of questions coming in around that. We will continue to keep you updated in terms of the timeline. I just want to remind you of that. And the other part of this is that there's a team that has been working alongside the 5 organizations to really talk through how do we make this seamless. And there is a way to access the services, which will be, you talked about how we deploy resources in the community. We actually have people working, the community health workers. We have what we call a care coordination team. They are working in various organizations, the 13 partners that Kimberly mentioned earlier, as well as within community-based organizations. So as we deploy these resources and make them available, you'll have a direct way in which you can contact and work with the SSHCO. Make sure that if you have clients, patients, or those who are interested in the program, how they can directly link with us. And there's a seamless process in terms of how you access these particular resources. And I just want to add this because Kimberly and I fully being transparent here, we're talking the other day and was just talking about how great these partnerships are, because so many times it can be a bit of red tape. We talked about removing barriers, and this is something that these partnerships, along with the SSHCO, is doing, is removing kind of that mystery and having people work directly with us so that they can have a seamless transition to the support they need and take out that mysterious piece in terms of connecting to services and care. So I think there are several questions in there, and I wanted to make sure that I kind of bundled that. Kimberly, I don't know if you wish to add anything around it from a targeted zip code area, but we are committed to the 15. I do see questions about Oaklawn, Evergreen, Burbank, and so forth. And I don't want to misspeak, but I definitely know that far as the prioritization and commitment today, how do they say, how do you chew an elephant one piece at a time? This piece is really focused on the Chicago South Side residents, but it does cover a very broad area in terms of going all the way to the borders of some of the South suburban areas. So it is a very broad map, and that is on the website as well. And I think we can send it out as well, if that's okay with the team.
Lisa, I don't have anything to add. I would add one thing, that we were granted to execute on our model and our work for the 15 zip codes that make up the South Side of Chicago proper. And so that is our focus for now. There are other collaboratives across the state and the Chicagoland area that have been funded to provide these types of collaborative services to other zip codes. So we are focused on the 15.
Okay, thank you. There were definitely a lot of questions around the service area, the geography. And so there's also a number of questions related to referrals in terms of how do we get patients to the organizations. One in particular from a doctor. In my practice at Jackson Park Hospital, I often encounter patients that need support to address SDOH, such as food, transportation, and housing insecurity. How do I refer patients to these organizations? And so it's a number of opportunities for folks to answer, Lisa, Kimberly, or Leif. So who would like to take it?
Yeah, I think we'll probably do this in a team fashion here. This is
Great.
This is evolving, right? I wanna say that we've been on several times here. This is a model that's in progress, right? And so we have selected this first group of sort of social determinant providers, plus we are seeing patients too, right? So we're looking at this from a couple of dimensions. I think the first piece is we wanted to have these outlets so that as folks were coming through the Southside Healthy Community Organization, our health workers, practitioners had an outlet for these needs. So that's a almost inside the model referral, right? So that's important. We needed to have these services in place. For now, for the question for the sort of public here, maybe health workers within other places, this physician, I think the best place to go so we can get the information and data to know where referrals might be coming from or where these needs are in these zip codes is to go to that email again. I don't want it to sound as though it's a default answer, but it is where we're bringing all of this information together to figure out where the greatest needs might be. So again, we're going to put this in the chat to everybody. It's info@southsidehealthycommunity.org. And so for that physician who may not be immediately connected to this model, we want to hear about that. And then second, we're actively looking at ways we can connect folks to these services. Yeah. Lisa and Kimberly, I don't know if there's something you want to build upon there. I can see everyone kind of ready to jump out of their chair, so I'll let that happen. But I'm going to put there we go. You can see the emails in the chat. Yeah.
The thing that I would like to add here is to be clear that our efforts and our resources are really driven through our care coordination process. So part of our the work that we do is through a care coordination process, working with individuals at our partner healthcare organizations. And so our efforts are actually driven through the care coordination process, and that really is happening at our partner sites. And so I want to be clear about that, because one thing that we do know, we do have to have focus around our general work and our general focal areas of the work being done in the organization. And so, Lisa, you may have something to add, but that is really where our work is driven through, that whole care coordination process.
Absolutely. I also wanted to add, kind of, I guess, as they would say, hot off the press, the great news is Jackson Park is one of the 13 partner sites. And so one of the things, if you are a practicing or practitioner at Jackson Park, you have direct access to our care coordination team. What I mean by that is they are literally embedded within your emergency departments and so forth. So we can definitely make sure that you have that information. We are working with various teams within Jackson Park as we kick off that relationship and so forth. But I am certain that there is work going on as we speak, so that you have direct access to a community health worker and a care coordination team, as Kimberly mentioned, directly and at your site at Jackson Park. So lots of good information there. And I wish I could recall the names and who we've been working with, but for the sake of the group, just know that that is happening, and that is part of the model which Kimberly spoke of, as well as Leif, in terms of really working with care coordination so that there is a seamless transition here. You don't have to, send your patients so many different places. They definitely have a seamless relationship with the care coordination team at your particular site, as we mentioned, Jackson Park and specifically.
Great, thank you all for those answers. And there's also a number of questions related to pricing. So are the services free from these organizations?
So we have funded these organizations with, and some of the other organizations may want to speak to their other services, but as it relates to the partnership and the grants that were awarded from the Southside Healthy Community Organization, the patients and residents that they serve from this perspective are covered in the grant that we have awarded to these grantees.
Thank you very much. And also there are questions related to partnering organizations. How can someone join the SSHCO? Is it still an opportunity for organizations to join?
So we have currently we have a board of directors, and our board of directors is made up of our 13. And when you say join, that's where I go, because that's where I think they may be speaking to. We have a board of the 13 healthcare organizations that make up the South Side of Chicago. Each one of those organizations have one seat on our board. We also have 3 community-based organizations that have a seat on our board, and I make up the 17th. I'm the 17th person on the board, and so we have 17 board members. But what I want you to know is that being a member of the board is not the only way that you can become partners with the SSHCO. And so I think that if there are ideas or thoughts or ways in which some of these other community-based organizations would like to begin to work with us more closely, although we've made these grants, there are other ways that we would love to continue to partner with organizations in the community. So again, we have that website. If you have thoughts, you can let us know. But that's where we sit from a board governance perspective now, but there's other opportunities to partner with us in many ways.
Okay, thank you. And I will give this one to Lisa. As a community health worker working with community members directly, will these organizations be added to the Unite Us platform in order to make the referral seamless?
We are working very closely, meaning the SSHCO, with Unite Us, and there's been a robust conversation taking place. And the answer is, while that is certainly a goal to add as many partners on the site, what we do realize, though, is that there are organizations which may not be a part of Unite Us. So what our teams have done, we have worked with various organizations, whether they choose to be on Unite Us or not. We didn't want that to be certainly the dividing factor of if we should work with an organization. So the quick answer is we are moving as many of those on the platform as possible. And we've worked with our teams, including CHWs and so forth, to create a process so that if someone is not on the Unite Us platform, that still gives us the ability to make a referral seamlessly, as well as make it trackable, because data collection is very important as well. And not only that, making sure that the experience that the end user, if you will, has as well. So yes, Unite Us is critically important to the process, but we have come up with other ways to work with organizations who may at this particular point in time choose not to go on the Unite Us process. But it is certainly the goal to get as many as possible on that platform.
Thank you very much. And I actually got this question in my chat. How do organizations who are currently working on these SDOHs, but were not grant awardees, plug into the network to provide more resources to our neighbors on the South Side? So how can other organizations, really connect to the 5 that we have funded here, but still they're not getting funded, but they want to give services to folks who are accessing the SSHCO? And we'll give that to
Leif,
Leif.
you want to take that one?
I think Kimberly and I can kind of do this together. I think we talked about this being the first sort of move here, right? It's a building process. I don't think it's the last time we will be reaching out to community-based organizations to look at wrapping around this model and supporting patients. This was the first step. It was the first grant. We were very excited to be able to make this kind of investment in partnership. So for now, again, I may sound like a broken record. It's okay. Reaching out to the info at southsidehealthycommunity.org is a great way to go. It puts it in the queue for us to understand sort of, oh, partners are raising their hand. I mean, we had for this grant 46 organizations that applied. Yeah. We are paying attention to all of those possibilities, right? We started somewhere. We started with the priority needs that were identified through our listening sessions and a number of channels, frankly, and through feedback through that email. This is something that we've been tracking along the way and will continue to do. So if you are an organization committed to this process, supporting healthy communities, partnering with our group, we want to hear from you for sure. That is a great way to raise your hand. And we will follow up. We have been following up. We've worked with all of the groups that applied at some level to really understand what it is that they offer. And we want to continue to grow that number. So do reach out. Kimberly, I don't know if you want to add anything to that, but this is something we're looking at for a long range improvement. So this is not the last partnership opportunity or collaboration opportunity that we'll have.
Oh, absolutely. Leif, I couldn't have said it better. So thank you for that. The only other thing I would add to that is that there are many other ways that we can, that we will be connecting again with partner organizations. And we get emails, sometime, and we address those, as Leif mentioned. We also get recommendations. I want to be clear about that through our email. We got one not long ago that said, hey, you just put out a new brochure, or a flyer. We got that, but we also want to challenge you or charge you with thinking about the fact that it needs to be translated into Spanish. And so as was mentioned earlier, this is a new organization we're continuing to build. And so that's certainly on our radar, and we will continue to grow and take these suggestions and just be patient with us and know that these things are on our list of things to do, and we will do those. So just communicate with us. Once again, community engagement is at the helm of everything we do.
Wonderful. And we are at time. Thank you everyone for your questions. And we will allow Kimberly to give that closing remark, and we can send everyone to their day.
Yeah, thank you so very much. That's really what I want to say to everyone. I think everyone on this call, and even those beyond that may not be present today, give us the energy and the encouragement that we need to continue to execute on this good work. And so again, we want to continue to hear from you. We want to continue to engage with you. Congratulations to our Social Determinants of Health award grantees. And thank you so much for being here today. We look forward to the next town hall meeting. Thank you so much. Bye-bye.